think that the daily number of confirmed COVID-19 cases is now in the 10,000s. Some experts say much of the spread of infection can be traced to people crowding in public transport. Authorities are now attempting to strike a balance between still allowing public transport to operate while minimizing transmission. More Informed discusses how authorities are doing this, or public transport under community quarantine conditions.
Metro Manila and adjacent provinces have been experiencing sharp spikes in the number of COVID-19 cases. This has prompted the IATF to place what they call NCR Plus under Enhanced Community Quarantine for a couple of weeks, and then to Modified Enhanced Community Quarantine. Earlier in the pandemic, the members of the IATF and health authorities have come to a consensus that public transportation must continue to operate for the economy and communities to survive and overcome the dire effects of the COVID-19 pandemic. However, public transportation necessarily sees people forced to come together in confined spaces of most modes of transportation allowed, including traditional jeepneys, modern jeepneys, buses, railways and light rail transits, vans, and shuttles. Many believe it was one of the major vectors of transmission that caused infections to spike. Others see the lack of adequate options for commuters as a problem that authorities need to solve. What are authorities doing to balance the risk of contagion with the need to provide adequate transport for frontliners, essential workers, these so-called APORs? One sign that public transportation can easily become a vector for transmission is the report that hundreds of rail and light rail transit personnel tested positive for COVID-19, forcing a reduction in the number of trains in operation. With thousands of passengers using light rail transits and railways on a daily basis, it isn't difficult to believe many were infected while at the station or on board the trains. The DOTR quickly directed the deployment of more so-called augmentation buses to provide transport to commuters affected by the reduction in light rail transit's operations. When authorities placed NCR Plus under ECQ, the DOTR expanded the Free Ride for Health Workers program to include free rides for APORs. DOTR Secretary Arthur Tagado also ordered an increase in the per-kilometer fees of public transport operators involved in the Free Rides program as an incentive for bus operations to provide the service. Secretary Tagado also encouraged more drivers to participate in the PUV service contracting program to benefit from incentives meant to allow them to make up for lost revenues from reduced capacity enforced by the IATF. The program was established especially to help drivers earn revenue even while strictly complying with capacity restrictions. Before the initial reversion to ECQ, Metro Manila jeepneys and some buses were seen to push past the limits of passenger capacity set by the IATF. Meanwhile, the LTFRB has opened 60 new routes for traditional jeepneys in Metro Manila, as well as 190 routes for provincial buses entering Metro Manila. It expects 1,800 TPUJs to service the 60 new routes, while 2,600 provincial buses are expected to serve the new routes after getting approval and meeting requirements of local government units. By allowing more PUVs to operate even under capacity restrictions, the DOTR hopes to discourage people from taking Colarm transport. The DOTR has also directed the LTO to go after Colarm operators and PUVs violating capacity restrictions, as well as mandated health protocols like frequent and thorough disinfection of vehicles. The LTO responded by reporting that an operation to check on jeepneys, buses, and vans operating in the NCR resulted in the apprehension of 51 Colarm operators and 27 PUVs that violated IATF and DOTR health and safety protocols. The Interagency Council on Traffic, or IACT, has deployed enforcers to check on EDSA carousel bus operations as well as the Parañaque Integrated Terminal Exchange as part of the intensified operations against violators of health and safety protocols in public transportation. Earlier, an incident involving a truck transporting passengers into Metro Manila and then transferring them to Colarm vans showed the kind of desperation for transport experienced by commuters. Many risk infection or worse, put others at risk of infection to go from home to work and back. This appears to be the state of public transportation amidst the COVID-19 pandemic, which many fear will continue far longer than when many hoped it would end. The DOTR and other authorities have been working hard to ease the economy back to normal, allowing more businesses to resume operations while imploring everyone to comply with social distancing and all other health protocols to stop the spread of COVID-19. The DOTR is also doing all it can to ensure public transportation is available for those who need it in various quarantine levels, again while setting protocols to help stop the spread of the contagion and at the same time helping the transport sector continue to earn enough revenues to survive.
At the end of the day, people must understand that each and every one of us must do our part in stopping the spread of the coronavirus. And this starts with faithfully following health protocols, regulations, and guidelines mandated by authorities. Every commuter, driver, and conductor must comply. Otherwise, the virus will continue to spread. That's our Motoring Forum this week, courtesy of Suzuki Philippines.